Good evening, everyone. I, Dr. Tini Tankachan, on behalf of Gleneagles Hospitals, Mumbai, welcome you all for today's session on heart attack. It is my immense pleasure to welcome Dr. Samir Pagad, who is a highly accomplished interventional cardiologist dealing with all aspects of cardiac diagnostics and therapy. He is a senior consultant now in active cardiology practice for close to 2 decades. He has trained from the leading institutes in the country. He graduated from Grand Medical College and completed his post graduation from GS Medical College and KM Hospital, Mumbai. He is one of the few national board certified interventional cardiologists in the city. Among the various other posts he holds, he serves as a consultant cardiologist to the governor of Maharashtra. Currently, he is a senior cardiologist in Gleneagles Hospitals, Mumbai. He has almost 10 publications and many awards added to his name. His qualification is MD DNB Cardiology, FNB Interventional Cardiology, FSCAI, FESC. We welcome you, sir.
Thank you. Thanks, Rajini.
So, to begin with, we would like to understand what is sudden heart attack.
So, heart attack is one thing, and it almost always is sudden. So, sudden heart attack is something which is uh, which is something which you always get suddenly a heart attack. What I would like to emphasize more is basically what is used interchangeably. These terms are used interchangeably by the lay people, and I would like to clarify that specially. So there's something called a sudden cardiac death or cardiac arrest. So that is also something which happens suddenly. And there is something called as heart attack. Now, a heart attack can lead to a sudden cardiac death. Now, what is sudden cardiac death? The sudden cardiac death, the sudden in that term makes it very, very dramatic. So that is where, people get shocked or people get psyched out of the fact that a person who is just roaming around or person who is just sitting absolutely fine and he just drops dead. And that is obviously very shocking, very, very hurtful for anybody. So that is something which people are too concerned about now, especially after the news items carrying this happening to various celebrities. So the reason why that happens is you all should understand that heart is a pump. It is a pump. It drives basically on electrical current. So there is a current which is generated inside the heart and which makes the heart pump. And that is the pump of life. That's the engine of life basically. So your heart is beating, you're alive. So when the heart pump suddenly ceases to work or ceases to function, that is when suddenly a person can drop dead. The beating of the heart is essential for the blood to be pumped to all the organs of the body. So, whenever the blood doesn't reach your brain, for example, because the heart has stopped pumping, the brain suddenly stops functioning, patient becomes unconscious or the person becomes unconscious, and for a few minutes, if there is no blood supply to any of or all of the organs because the heart is not pumping, that is when the organs cease to function on a permanent note, and that is when a patient actually clinically dies. So, as again coming back, heart is absolutely essential for the life to exist, and because of that, a heart needs to pump. The moment your heart ceases to pump or ceases to function, a patient has what we call as a sudden cardiac arrest. So that is sudden cardiac arrest, sudden cardiac death. These are the correct technical terms. Now, coming to heart attack. Now, heart attack is something which I'm sure most people would have heard. Someone whom they know has had a heart attack, and you live, you come back to function, you get treated, and you come back to function gradually. So, people definitely can survive sudden heart attack, but a sudden cardiac death is a fatal thing. And heart attack especially happens because the blood supply to the heart is supplied by three main tubes or three main pipelines. So these are called the coronaries. So whenever you have a total occlusion in the blood flow in one of the coronaries, that is when a person has a heart attack. Now, if this heart attack is major or if the main coronary artery is blocked, then that major heart attack can lead to a sudden cardiac death. So I hope I'm very clear in the terminology. So this is important for people to understand that a sudden cardiac death is something which is serious, of course, and needs to be acted on within a few seconds, the first few seconds. A heart attack, on the other hand, the patient gives you time. You need to reach to a well equipped cardiac care center.
So, what are the causes of this occlusion which causes heart attack?
Yeah. So, as we just mentioned, a heart attack is caused by an occlusion to the flow of the blood to the heart. Now, heart, as I said, is a muscle. Now, imagine this is a heart going. Now, if I occlude blood supply to this portion of the heart, suddenly this part of the heart ceases to be involved in the pumping. So it's supposed to pump like this. Now suddenly there is no blood supply, so this doesn't pump. So only this much pumps. So that is when a person's portion of the heart suddenly stops functioning because there is no blood supply. Blood supply is the lifeline because that is where your oxygen, your nutrients reach any of the muscles. So for a muscle to work, it needs nutrients. So that is what is supplied by the oxygen and the nutrients inside the blood. You stop the blood supply, that portion suddenly stops functioning. Why does this happen? Now, the blocks can happen due to various reasons. So, that is where your other risk factors come in. So, your diabetes, your blood pressure, your cholesterol, your family history, your smoking, your lifestyles, obesity, stress, all of these factors are reasons enough when the blocks, or what we call as cholesterol deposits, keep accumulating inside these pipelines which we talked about, the coronaries. And once this accumulation is significant enough to totally shut off blood supply to one of the in one of the coronaries, that is when a person gets a heart attack. So that's what is heart attack. And that's the reason why you get a heart attack.
So we have seen many videos nowadays on Instagram where the people who are working out, suddenly there is a collapse, sudden there is a heart attack. So is it because of the overdoing of the body or the causes that you have rightly mentioned now?
So again, now let's assume a very healthy person, as you said, working out in the gym. So we'll assume that he's otherwise a very healthy individual. Now, in these healthy individuals, these videos which circulate, when suddenly they have a problem and they collapse, and the reasons for this is one, he could have be having a major heart attack, as I mentioned. So, if the major portion of your heart doesn't get blood supply, so it hardly functions, and because of that, the patient can cease to live, and that's when clinical death happens. So, that could be one of the reasons. A major, massive heart attack has caused a sudden cardiac death. The other commonest reason why patients just collapse and die is basically because of an arrhythmic death. Now, what is an arrhythmia? Now, a heart is supposed to beat at a regular rate of around 70 to 100 or 60 to 100 beats per minute. A good, healthy heart beats at around 60 to 100 per minute. Due to any reason for whatsoever, suddenly the heart starts beating at a very rapid rate, maybe 300, 350 rates per minute. So that heart beating is incompatible with life because the heart is not able to pump out blood. It has to pump out blood so that the whole body gets blood supply. So if it just shrivels like this, it's not functioning the way it's supposed to function. It's just shriveling for the heck of it. So when that happens, when the rate goes up at a very high rate, the blood supply or the function of the heart is not being done. And that is when, again, because the blood supply is not available to most of the organs, the patient clinically dies. Now, why do these arrhythmias happen? Why do the heart rate become suddenly high, or even if the heart rate becomes suddenly low, then also it can cause these kind of sudden cardiac deaths. Why does it happen? There is again various reasons. That is when the electrical system of the heart. So heart has got a plumbing system, which is the pipelines, the coronaries, which I mentioned, and then there is an electrical circuit. So electrical circuit, if there is any problem, that is when you have these tachyarrhythmias or a bradyarrhythmias are the technical terms. Tachy means when the heart rate becomes very fast. Brady means when the heart rate is very, very low. So both of these things can lead to a sudden cardiac death. So what has been found out in many of the healthy individuals who have these sudden kind of deaths is usually some form of an arrhythmia, usually some form of an underlying heart disease, usually a congenital underlying heart disease, which has remained undetected because it has never been tested. So these are the common causes when patients have sudden cardiac deaths. For example, hypertrophic cardiomyopathy is one such particular terms, which makes the person prone to develop these kind of tachyarrhythmias. Hypertrophic cardiomyopathy might remain undiagnosed unless you get an ECG or an echo done in a routine checkup. It can absolutely remain asymptomatic. And the first presentation is this tachyarrhythmia when the patient just collapses. And that's the unfortunate nature of the disease.
So, what are the symptoms of heart attack?
So heart attack. So heart attack is again because blood supply is not there to portion of the heart. So when that happens, classically, the patients or the person who could be your family member, who could be your relative, who could be your friends, usually they start complaining of chest tightness. So chest tightness again, there's always a lot of confusion. Any small chest pain here and there, people are very scared nowadays, very skeptical about these things, very paranoid about these things, where they think that anything could be a heart attack. Yes, I would say it's a better option if you are in doubt to get evaluated for whether it's a heart attack or not by just doing a simple ECG. So the classical symptoms would be again a chest heaviness. It is like a vice-like feeling or a big stone or a heavy object has been kept on your chest. That's the kind of sensation which the people, a person who's having a heart attack will have. It's usually associated with mild sweating. Some kind of sweating would be there. The pain sometimes can radiate to your left arm classically, or it could radiate to your jaw or the mandible. So these are the common symptoms of a heart attack. But having said that, heart attack can present in various ways. It can just present as a upper back pain sometimes, or just a jaw pain sometimes. It can present as an epigastric or the stomach, upper stomach area, that kind of a pain sometimes. So the dictum is if you are having some doubt regarding these kind of pains, if you have any of the risk factors which we mentioned previously, then it is always a safe thing to just do a simple ECG and rule out a heart attack. Everything else can be treated easily, like it could be an acidic gastritis, it could be muscular spasm or pains. All of that can be treated very easily and they are not life threatening. But if you miss out on a heart attack, that could have serious consequences. So that's how heart attack patients usually present.
So, a patient who's experiencing this heart attack, how can he or she differentiate if it is related to heart or some gastric issue?
So that's very difficult for a patient to differentiate because it's difficult for us also to differentiate. It's not so easy. So that is where the crux of clinical medicine comes in. So there are some small pointers here and there which can tell us whether this is a gastric problem or this is a heart problem. But again, having said that, they always do tend to overlap. So we as clinicians also, whenever there is any kind of a doubt or whenever there is any kind of a pain near the chest area, an ECG is the bare minimum which we would always advise, especially in the high risk category. When I say high risk, it could be a elderly gentleman with diabetes and blood pressure who's been a smoker with any form of chest discomfort, even if it is clearly a gastric kind of a chest discomfort, we would not send him home without doing an ECG. An ECG is a bare minimum because it's worth that effort to do an ECG and rule out a heart attack rather than err on the other side and have a heart attack and think it is acidity or gastritis, and because the consequences are terrible and too high a price to pay for this.
So, apart from this high risk criteria, which category again is prone to heart attack?
So again, it again boils down to what are the risk factors for having a heart attack. So let's have a couple of examples. So if it is a young girl without any of the known risk factors like non-hypertensive, non-diabetic, never been a smoker, young girl with some atypical kind of chest pain. When I say atypical, means not the way I described it previously, like a heaviness in the chest and all, a very atypical kind of a presentation. I would not be too concerned about this kind of patient profile, because then I know that in all probability, the clinical likelihood of her having a heart condition is extremely low. Having said that, again, if it is the other extreme, say for example, as I said, an elderly gentleman who is a hypertensive diabetic, a smoker, who comes with some kind of a chest discomfort, I would be more suspicious that I would definitely think that this could be a heart condition unless proved otherwise. And anyone who comes in between, then it becomes a clinical judgment. The more the number of risk factors you have, the greater the chances of you having a heart attack. And that's why preventive medicine always harps on the fact that try and reduce your risk factors. If you have hypertension, keep it under control. If you have diabetes, keep it under control. Cholesterol, keep it under control. Obesity, try and reduce it. Smoking, absolutely stop it. If you are familial inherited genes which are making you prone to heart attack, get regularly checked. So these are the things which we should keep in mind. The lesser the risk factors, lesser the chances of you having a heart attack.
So, how is heart attack treated?
So when you have a heart attack, again, the core or the basic pathology or the basic reason is one of your coronaries is totally occluded, or there is a significant block in one of the pipelines which supplies blood to your heart. So the basic treatment is aimed towards removing that block and renewing the blood supply to the heart. So the faster you do this, more the chances of the heart having a recovery fast. What is the best method to do it? Now the best method proven worldwide all over the world is doing an early quick angioplasty. And why is that so? Why an angioplasty in the middle of the night? What's the big deal? Why can't you wait till a good hours? Why do we rush into do what we call as a primary coronary angioplasty? The reason is, with an angioplasty, what I as a cardiologist is doing is I'm physically going into the coronary, removing the block, sucking out the block, ensuring blood flow, putting in a stent so that the blood flow is resumed as early as possible. Now, we all have heard the dictum, minute is muscle. So, every minute you save and every minute you save in getting this renewal of blood supply, the greater the chances of avoiding permanent damage to the muscle of the heart. So the faster you do it, the better it is. And the best way of doing it is actually going in physically and removing it and coming, which is called as primary coronary angioplasty. So that's called as primary angioplasty in myocardial infarction, or PAMI, and that is proven beyond doubt worldwide in scientific trials, without any doubt, is the best form of treatment for a heart attack by any measure. Now, by any chance a person is not equipped enough to go to such a center which offers these kind of treatment, the next best level is what we call as clot busting injections. So you should understand that is a clot which is sitting there in obstructing the flow in the coronaries. So clot busting injection given again adequately in time is actually going to relieve that clot or burst that clot so that the flow is resumed. So that's the next best thing which a person should aim for. So heart attack treatment basically is importance is to give timely treatment, very, very quick treatment. The faster you get treatment, the better the chances of survival. And these are the two best options which you have to treat heart attacks.
So, a person who has already undergone angioplasty, is there any chance of reoccurrence of cardiac heart attack
So
in
yeah.
future?
So what do we do in an angioplasty? In an angioplasty, we basically, if there are any blocks, we remove those blocks by whatever measures, rotablation, balloon dilatation, and then we finally put in a stent so that there is no elastic recoil and the blood flow is continuously going to the myocardium or going to the heart. That is what, in short, is angioplasty. Now, a person can have a reblockage due to various reasons. One, suppose this is the whole artery. I have done an angioplasty in the proximal part, put in a stent there. Now, what is to prevent a block from happening in the midsection of the artery, in a separate, in a different region of the same artery, or a region, different artery, he can have a block. So, how do you prevent that? The only way to prevent that is by controlling your risk factors. What we do in an angioplasty is that particular block is being treated at that particular time. Now, for him to not have a block again in a different circuit, in a different area of the circuit, is what is going to help him is preventing the risk factors. That is controlling your diabetes, treating your hypertension, good diet, good exercise, healthy lifestyle. That's what is going to prevent these blocks from happening again and prevent him from getting a heart attack. A very small percentage of patients, unfortunately, can get a heart attack in the same area which has been stented. That is what is called a stent thrombosis. But that has come down significantly low now with the newest variety of stents which we use, the newest drugs which are there. But it is not zero as of now. So there's a very small percentage which can still happen. So there are again ways and means which your cardiologist will always tell you when they undergo an angioplasty. That's to prevent these kind of things from happening.
So we have heard people saying, they're sharing their experience. Last night I had some breathlessness and some heaviness of chest. I just had some sips of water and I slept off. So is it a heart attack or it can be some other issue?
So again, this is a very classical example which patients come to us. I was feeling all right. I was feeling some problem in the night. I just slept it off, took some Gelucil syrup or some Eno I took, and I slept off. And I am fine today. I didn't want to disturb the whole family in the middle of the night by waking up and getting to a hospital. Now, this is the commonest mistake which many people do it. There have been instances when people have had that, and unfortunately, they don't wake up the next morning if it is a massive heart attack. People have come to us, lucky ones. The morning later, they come with an evolved heart attack which happened at that time. You already lost those few hours where you should have been treated at that time. As I said, the earlier you treat, the more the chances. So that has already gone. The golden hours have already gone. So you come with an evolved heart attack. So, as I said, coming back, the dictum still remains when in doubt, whether having some form of a chest discomfort, the bare minimum is to go to a nearest center and get an ECG done. An ECG will definitely pick up a heart attack. So that is the bare minimum which people need to do, and do not neglect these kind of symptoms saying that it's gastritis or acidity, because many a time these are the symptoms of a heart attack which patients just sit on it and then later come to us with a heart attack which has already evolved. Because when it has evolved, you already have lost that opportunity where you could have saved that portion of the heart to completely revive it. Once it's permanently damaged, that portion of your heart remains damaged forever. You can't do anything to get it back. So that is the unfortunate nature of the disease.
So how can we prevent heart attack?
So prevention of a heart attack again boils down to preventing from plaque or preventing from blocks to happen into your coronary arteries. How are you going to prevent that? Why? You should know why it happens. So it happens because, as I said, these are the risk factors which make it prone to developing or to accumulating plaque material or cholesterol deposition in your coronaries. So the more you keep your risk factors under control, or the lesser the risk factors you have. So if you are blessed with no diabetes, no blood pressure, no family history, you've been a non-smoker, you are the most blessed guy who might, in all 99.9%, you'll never have a heart attack. But if somebody or many of us Indians basically are having to deal with blood pressure, diabetes, cholesterol, so if you can keep these numbers, aim for the numbers. Your blood pressure of 130 by 80, cholesterol less than 150 or 200, your diabetes, keep them within control. HbA1c, the 3 monthly average, if you can keep it below 6.5. So that should be your aims. Chase the numbers. The more you keep them under control, the better your healthier, or the healthier your lifestyle. Like, you should definitely stop smoking. Smoking is number one reason where you can directly get a heart attack. So there is no excuse for you to not stop smoking. Smoking has to be stopped. Healthier lifestyle you lead, the more healthier lifestyle if you can lead, the lesser the chances of you having a heart attack.
Thank you so much, sir, for sharing your valuable insights. I think this is a very common episode happening these days. Uh, it is a privilege to have you with us and sharing your words with us. Thank you so much, sir.
Thank you. I hope it's been worth the while.
I thank all my audience for spending time with us. Stay tuned and stay healthy until our next session.
Thank you. Thank you very much.